Okay. Thank you all for joining us today. My name is Jessica Naftali, and I am the past chair of the Society for Health Psychology Student Advisory Council. I'm also a doctoral student at Rosalind Franklin University and a current intern at Hines VA. Co-hosting with me today is Terrence Penn. Terrence, you want to introduce yourself?
Hi, my name is Terrence. I'm a rising fifth year in the UAB, University of Alabama at Birmingham, medical clinical psychology program, and I will be applying for internships soon for like a lot of you here. I'm just happy to have all the panelists here speaking today, and thank you all for coming in this evening, and happy to have all of you participating as well in the chat over here.
Thanks, Terrence. And Terrence will be monitoring the chat box and letting participants into the room. So please be patient with us as we're conducting this event virtually for the first time. We know this is a really difficult time for everyone. And again, we really appreciate you joining us. We know that lots of you that are applying for internship and postdoc this year and have many questions about the application and interview process, and we hope to get those answered for you today. Again, a few logistical things before we have our wonderful panelists introduce themselves. Everyone except the panelists or moderators will be muted during the panel. If you accidentally unmute yourself, please mute again if you can. Terrence will be making sure you're muted as much as we can. If you're using the speaker view, that will help you focus on who is speaking instead of the gallery view, and you should be able to do that at the top right corner of Zoom. Many of you submitted questions ahead of time, and we will be answering some of those questions today, and we'll be alternating as best as we can between postdoc specific questions and internship specific questions. Because you submitted so many great questions, we will be limiting to the number of questions that we answer outside of the ones that have already been submitted. So we can answer clarifying questions through the chat, but we probably won't be answering any new questions. The Society for Health Psychology Student Advisory Council will also be hosting an internship panel Q&A with recent and current interns. That will be at a date to be determined. Keep an eye out on the listserv for more information. And it'll be open to both members and non-members. And a shameless plug, if you're not already a Society for Health Psychology student member, you can join today for $30. And if you join today, you'll get membership for the rest of the year and for next year. And with that, I'm going to have our panelists introduce themselves. I'm going to have Dr. Voss start first.
Hi, everyone. Thank you for inviting me. My name is Shona Voss, and I am the training director at the University of Chicago Medical Center. We have 2 adult health psychology internship positions. We have a pediatric child psychology position and 2 neuropsych positions in our internship. We also have a peds psych fellowship and an adult psych fellowship, and we have many, many externs who are applying for internship this year. In addition to my training director role, I also serve on the APIC Board of Directors, where I'm currently the secretary and the chair-elect. Thank you.
Dr. Christensen.
Hi, my name is Heidi Christensen, and I am the training director at the Medical College of Wisconsin. We have a APA accredited health psychology internship, which we refer to as our health psychology residency program. And we also have a fellowship in clinical health psychology. And with regard to APIC, I am newly a member of the APIC membership and selection committee. So thanks for having me.
Last but not least, Dr. Shu.
Hi, I'm Jeanette Shu. I'm the Director of Training at the VA in Palo Alto, California. At VA Palo Alto, we have an internship program, postdoctoral training programs, and also practicum training programs. In our internship program, we have a behavioral medicine track, and in our postdoctoral program, we have several health psych related special areas of training, including behavioral medicine and palliative care and geropsychology and rehabilitation psychology. Regarding APIC, I'm a former member of the board of directors, And currently, I am a member of the Postdoctoral Membership and Review Committee.
Great. Thank you again for being here today. So we'll just jump right in. Lots of questions about the impact of COVID-19 on internship and postdoc applications. One of the first questions is just general changes for the upcoming year regarding internship and postdoc applications in relation to COVID. It's a very broad question, but whoever wants to take it first, go ahead.
When I got on this call with Jessica 5 minutes before we started, I had looked through the list of questions and I was struck by how many of those led to an answer of I don't know. So I just wanted to sort of put that out there and say to you all that this is a time of tremendous uncertainty, and what we think we know today might be different in 2 months and might be different in 6 months. So be patient with yourself, with us, and with this process, because it's sort of an evolving situation and is certainly likely to change over the next few months. So I'll put that caveat out there and stop talking.
I was going to jump in about, I think APIC, and Dr. Voss, you can probably say this, APIC is really encouraging all of our internship training programs to offer virtual interviewing during this upcoming interview season, given that the pandemic is unlikely to subside substantially by the time that people are usually traveling December and January. And I think there are many groups of sort of subgroups of internship programs have already committed to virtual interviews only. So I think that that's one thing that we've decided pretty early on. Certainly we're doing that via Palo Alto. Many others are as well, have committed already to that. Does that kind of at least address that big piece there? I mean, I think there's some questions that the group had about how our applications reviewed and how our hours counted. Is telehealth going to count? What if you haven't had any telehealth? And I want to echo Dr. Voss too, that we're all kind of trying to figure this out ourselves. And so when we're answering these questions, we hope we're not seeming like we're being evasive or anything. So there are some things we don't know. But I think that, our best intentions are that we're going to take into consideration that a lot of your training was interrupted this spring. I know some of my incoming interns, they told me that they had a lot of time actually to work on their dissertations, which was like kind of the upside of things. They were able to actually defend their dissertations this spring. And use the shelter in place time to do that. We certainly will be considering that you've had practicum externships interrupted, and really think about, for us, we're thinking about what have you already done? What is it that you are interested in? What are you focused on? What have you missed because of COVID? And certainly, what can we still offer you? I know many of you are worried about maybe numbers of hours, and really, I know APIC has always been trying to, even though APIC has always focused on reporting of hours, we're very much concerned more about competencies. And so we're not really going to say, well, someone has only 295 hours and, my cutoff is 300, I won't consider you. We really, I think everyone's going to be really flexible. Again, I can't speak for everyone, but I think that's the intention, is that we're not going to punish people for things they can't control.
Yeah, I can also echo that in terms of number of hours. We haven't changed the minimum number of hours for our site, but I did put a disclaimer as I'm updating our materials saying, as usual, this is only one in a number of many variables that we will be using to evaluate your application. So if you think that you're a good fit for a site and you're short of the expected number of hours, go ahead and apply and be prepared to discuss what you missed in your training, and how that sort of factors into your application.
And I can echo what the other folks have said so far. Can everyone hear me? Okay, sorry. What we've noticed, so we're an academic medical center, and so the AAMC is actually required that all medical school and residency training be done virtually, and so our program has really done the same thing. So we'll be doing all of our interviews virtually this year, which is a little bit sad because I know that people, when they like to come to a site, get a feel, and I think that's where people really see us shining of a lot of sites, including our own. But what we're trying to do is we're trying to come up with other ways to show you videos, have breakout sessions with our current residents, so you actually get a feeling for our program, even if you're not here in person. So same thing with what everyone else is saying with regard to the hours. I don't think anyone can look anything with a firm line right now. And I've also been trying to look at this from a strengths perspective of, I was never really particularly interested in telehealth prior to this. And we do have some people actually on our faculty who had extensive experience with telehealth in the past, thank goodness. And so this is really kind of an opportunity to train in an area that you might not have even considered or worked in before. So as we're evaluating people, we're gonna look at what are some different competencies and skills you might have developed over that time.
I think regarding telehealth, I wanted to maybe add that there's some of you who have had now the opportunity to do telehealth, and that's great. I think that you can always highlight that in your application. That is a strength. At the same time, we're not going to be penalizing anybody for having not done telehealth yet. We all actually learned that really quickly, starting in March. And so we're very confident we can train you in telehealth really well. I have suggested to some of my incoming interns that there was, at least earlier this spring, APA had a free telehealth workshop. And so I have sent other resources, and it's probably a great idea, if you haven't done telehealth yet, to just do some reading and possibly do some trainings, just to be able to speak to it, because at this point, again, we don't know what's going to happen, what's going to be, how the training is going to be in the 2021-22 training year. We hope that the pandemic is much more under control by that time. But if not, we'll be doing what we're doing with our incoming interns and fellows now, which is primarily, some of you asked the question, what is happening at the training sites now? Primarily, we're doing telehealth for all outpatient visits, and for inpatient ones or residential treatment, we have different precautions and modifications for that. But that's what we've been doing since March, and planning to do so with our incoming trainees. So if you have telehealth skills, that's always, I think from this time forward, telehealth is probably going to be much more common even after the pandemic.
Yeah, kind of going off of that, someone had asked, would it be wise to apply to more programs than typical if they are shorter on hours this year?
I can answer that question. I would say it's not wiser. I think one of the things from a training director standpoint that I'm a bit afraid of is that there's an investment in coming to our site and flying all the way to Wisconsin, for example, that really shows kind of like, I'm actually interested and I feel like a good match with this program. And I think it's very easy to apply to 20 sites this year because of the pandemic, but I do think that's just going to make the interview process that's been working incredibly well throughout APIC really convoluted and difficult. And so I think it's going to make phase 2 a little bit more difficult. So I know things feel maybe scary and uncertain, but the thing that I encourage you to think about is that I think it's most people get their top 3 ranks regardless. So I think it's probably going to add more confusion and anxiety to an already kind of upsetting situation. And the other thing you have to remember is this is a cohort effect. So it's not like just something happened to you personally. This happened across the entire world. So how it impacted you is going to impact the other people similarly. And all training directors are going to be, I'm guessing, are going to be thinking relatively similarly and graciously about that.
Yeah, I also would encourage you to just apply to the places that you're really interested in, and not more than you usually would have. I think that again, as Dr. Christensen was saying, this has happened to everyone. And so please target your applications. It's much easier for us as our training programs to actually figure out who's actually a good fit for us if people aren't just applying kind of, I was going to say indiscriminately. I know you're not really doing that, but like really just blanketing, kind of more than you're interested in, because it will just make it harder for us to figure out once we've ranked everything, who's actually going to come. And so just really the places you can really imagine yourself being and really good fits. Again, the internship imbalance is now there's more positions than there are applicants. So the odds are in your favor. Just keep on doing that. Be really particular about where you want to go, and spend the time actually to try to figure out what sites are going to be good fits for you. That you might have to take a little more time to peruse the videos people send out or talk with former interns or fellows, just so you can get a good feel for what that program is like.
I would agree with that as well. The match data from the last few years, which you can find on the APIC website, are going to show you the point of diminishing returns. And I would say that at past 12 applications, you're probably not dramatically increasing your chances of matching. I would add also, the more applications you have, the more chances there are to make mistakes, to not pay attention to detail, to keep track of several different other variables. And it just makes for more work and makes the process much more complicated for you. I think that, if that shows in your application materials, you really don't want that to be how you're perceived.
Yeah, thank you all for that. In what ways has COVID affected those who are applying to postdoc, their ability to find a postdoc and then also obtain a postdoc for the year 2021?
From an APIC perspective, one of the things that we've been worried about is that the funding climate has led to postdocs shutting down. And so we have encouraged people to really look ahead to their budgets for next year and to not advertise any positions that are potentially vulnerable to being cut. And the same is true for positions that go in the match. Our match contracts are due by the end of the month, I believe. And so for people who are putting their match contracts in, we expect that those positions will be offered in the match. And I know postdocs are a little bit more challenging, and some of those decisions might evolve over the next few months, but keep looking at the UPPD, keep checking in, keep making sure that the positions that you want to apply to are in fact available.
I was going to say, at our site, even though there was a faculty hiring freeze, our training program, including our postdoctoral fellowship, was pushed through, and our program plans to expand this year. So I think it's important to keep in mind to keep an eye on funding. But the other thing that I want you to keep in mind is there are a lot of different postdoctoral fellowship programs. So I would encourage you to just focus on finding good fits and stay hopeful and optimistic. And I don't think it's time for gloom and doom quite yet.
I think that this past year, our current interns, I think most of their postdoctoral selection was actually concluded prior to kind of the initial big surge in the pandemic. And so they have not, they just secured all of their fellowships, by February, end of February. So they didn't have any trouble with that, and no postdoctoral fellowships, as that I've heard, for my interns, have lost funding. And as I hear from APIC also, there's still many postdoctoral positions that are still open, actually. So in some ways similar to the sort of the supply demand, kind of internship. There's many more postdoctoral positions than there are people applying to them. That said, I'm not as familiar right now with how how research fellowships are being impacted, because there was a freeze at one point for non-essential research, I'll have to be stopped. And certainly maybe you know this from your graduate programs, that some of your research and data collection, a lot of kind of labs had to be shut down or like kind of restricted. So there may be some impact that I'm not really as aware of on research fellowships. At the same time, there's other grant funding seems to be coming through. One of my interns is actually, she's considering possibly a research fellowship instead of the clinic. There's a long story to that one, but there's other funding that had just come up in the summer actually for research fellowships. So that the funding is still coming through.
Someone had asked, what's the best way to find out about postdocs? We know the APIC directory, listservs, any other suggestions for ways to find out about postdocs?
I think that this is one of the seminars I give my interns about finding postdoctoral positions. I mean, APIC does a really nice job to try to capture as much of the sort of universe of regularly posted postdoctoral positions in the Universal Psychology Postdoctoral Directory, the UPPD, and so that's available at the APIC website. But I think that's one thing that's different than internship selection is that for postdoctoral search, it can often rely on like networking, word of mouth. There's a lot of positions that are actually not posted, and it's really great to stay in touch with your mentors, your advisors, your internship training director, your supervisors, and just say like, I'm really interested in psycho-oncology and certain kind of research in psycho-oncology. Could you let me know if anyone is looking for a postdoctoral fellow? And this kind of search seems to work really well too. That if you're not looking for something that's kind of regularly posted, there's a lot of people who actually have grant money to fund postdoctoral positions in different areas. And so word of mouth is really important, really helpful. And there's the VA also has a psychology training website, and that lists research focused and clinical focused fellowships in VA. I think staying close to, closely looking at your mail groups like from SBM or ABCT or, whatever professional groups that you're a member of also lists a lot of postdoctoral fellowships. But I think word of mouth, the UPPD, those are really, really great resources.
I think the challenge with postdocs is that you have to look in multiple places at once. So you have to be on several different listservs. I would encourage you certainly to be signed up for Division 38, for APAC, for health site postdocs, for SBM. SBM has special interest groups. ABCT has SIGs as well. So all of those are different avenues that might be appropriate for you. I'd like to think that by the time you are getting to postdoc, you have some sense of where you might want to end up geographically. And so state associations, I think, and those websites are also avenues that you might not have thought about up until this point, but many state psychological associations will also advertise postdocs. And then APA's early career directorate has a listserv that you could sign up for as well.
Great, super helpful. Kind of going back to the interview process a little bit, we talked a little bit about how APIC is encouraging virtual interviews. For someone who asked about, hypothetically, if a site is requiring or strongly encouraging applicants to come in person, how to navigate that.
I'm wondering are there many sites that are doing that? Have people run across that so far? I can't imagine that we're going to run across many sites.
I don't know, maybe it's more of a fear than something that's actually happening. I'm not 100% sure.
I think historically, sometimes not traveling to a site could be seen negatively because maybe you thought, well, I don't really have the interest, but sure, I'll talk to you on the phone. But I think the rules have all changed. So I imagine, so our site, a lot of academic medical centers are by nature, I think, are doing what our physician colleagues are doing. And so I imagine a lot of people will be doing that. But if they're not, and you told them you were not comfortable traveling due to the pandemic, as a training director, I would not see that as not interested in my program this year. But that's just my feeling.
And if it is a site that insists that you must come, I wonder if that gives you some information about the site and whether you would fit well there. I do want to say that it is possible also that many sites have not yet updated their training materials. I know I certainly haven't, because I'm just recovering from orientation of my new trainees. So I haven't turned my mind yet to updating my internship materials for next year, but it's coming.
Yeah, I also am thinking that I can't imagine that a lot of the, well, maybe there are some medical centers in more like less impact, I guess in less impacted, I was thinking more rural areas possibly that may perhaps are still operating like in person. But if you haven't visited any of these medical centers recently, like like for example, in VA, we don't even allow any visitors on our campus. Like no visitors are allowed, and only patients for urgent care issues. And so, we're not going to be allowing, I think VA generally, they're not going to be allowing visitors coming for interview. Even if we decided we really wanted to see you in person, it's just not going to happen. I mean, I think it would be important to, like, as Dr. Voss was saying, like, just wait for the updates, wait for updated brochures. I mean, everyone also is needing to, we're also being asked to update our brochures to include COVID related information. So that also means it's might take a little bit longer to try to make sure all that information is accurate and updated for this coming year. And then if you don't hear that information, I think it's okay to email the training director and say, like, are you still requiring in-person interviews? How is that going to work? I'm not sure, I'm not sure that I would feel comfortable. Would you accept a phone or Zoom interview? And I think it's okay to say that and find out how they respond. I do think it's good information to see if they're going to be sympathetic to your situation.
Great. When it comes to interviews for both interns and postdocs, would you have any suggestions for how to prepare for virtual interviews compared to in-person interviews?
I'd say have technology backup plans. We've learned the hard way that things go wrong. So, make sure that you're in a place with stable internet, that you're in a private space. Remember that you are on camera at all times. So just like when you go to interview at a site, you never know who's riding the elevator with you. I would keep that awareness in mind. And I think asking lots of questions is going to be key this year. I hope you do that anyway, but asking about the aspects of the site that are most important to you and finding different ways to gather that information will be critical.
I think it's still important to do what you typically would do for, in preparing for an interview. You can, there's lots and lots of places. APIC has lists of questions that could be typically asked. And just preparing for those questions, actually doing practice interviews on Zoom to make sure that that you are coming across the way that you want to, and get feedback from whether it's an advisor, your friends, your partner, someone like who can give you good advice and give you the kind of their perspective and observations of your interview demeanor and interview responses. That'd be really great. So that, I mean, we all understand everyone's nervous, and so that's pretty expected. But, you know, being able to feel like you're going to be at your best and just practicing is going to be a good idea. I would also say, like, and people always ask this question anyway, when it's in person, it feels like, what should I wear? I mean, I would wear a suit. That's what I think you're an interview, you know, whether you're wearing your, you know, whether you're wearing at least, you know, from the waist up, like, you know, but I would personally want to wear, just feel like you're really wearing your interview suit, just so that you feel like you're, you know, kind of like in your kind of confident professional self. I think is really important. I mean, and I think we're all used to Zoom right now. You want to kind of be a little bit aware of what's in your background, as well as Dr. Voss was saying, like, kind of like kind of a private space that you feel like you're not going to get distracted, or people aren't going to be walking in and out. And if that happens because your cat walked into your Zoom, like, we're not going to, you know, ding you for that happening. We're all in the same situation. So, but as much as you can, you know, kind of set that up for yourself, and then you'll feel much better that you can concentrate and be at your best in answering the questions and asking the questions you want.
Dr. Christensen, anything to add?
I didn't know if you wanted us all to answer all of these, because I would really echo what the other two folks have said. The only small thing I think I can add is that I think about this as, you know, we're really looking for, what I'm looking for is does someone have a genuine interest in our program? Are they a genuinely kind and approachable individual? And then I also want to get a sense of what their boundaries are in a virtual world. We've done a lot of training of our residents this year on how to have a professional space when you're in your home. And yes, everyone has a cat walk by from time to time or something like that. But I do think about it as you're also kind of showing your supervisors or training directors how you might be in a professional setting on a telehealth platform. So just keep that in mind.
Great. Kind of going off of interviews still, we mentioned a little bit earlier how some places might have video tours or still have those conversations with current interns. What's the best way to really get a feel for the internship site with interviews being virtual?
If we knew that, oh my gosh, I think this is one of the most stressful things. I don't know for the other training directors here, kind of, I don't want to say keeps me up at night, but it's taking a lot of my professional time right now. Because I do think that you should feel it, you know, we've been talking about finding a really good match. You know, the training you want, is this the place that you can get it, and is the dynamic interpersonally what you're looking for. So at our site, what we're going to be doing is we're actually going to mimic our entire interview day, because I think anyone can maybe put on a good face for about an hour. And so we're really going to try to allow people to hear about our program. We're going to allow individual interviews with all of our rotation supervisors, so you can get some one-on-one time with those people. We're going to have breaks in there so that you don't want to cry in front of your computer. Then we're going to have some tours, which are challenging because we're trying to create this digital material really quickly. So we have a really amazing colleague of mine who's a psychiatrist who's taken this on for all of our training programs in our department. So let's hope it works out. But what we're going to try to do is mimic it as much after our full day to give you as much time as you can, and as we're saying, for asking as many questions as you possibly can to try to get to the real feel of the program. Heidi,
I'm a little jealous that you have someone who's volunteered to make videotape tours.
And he has no reason to. I'm like, can I wash your car? He's an amazing individual.
Yeah. So it's totally keeping me up at night, wondering how we're going to do this, thinking about how we can collaborate with other training programs, residencies, fellowships within our department, and pool our resources. We are also going to set up in the same way a day-long experience, just as if you would come. The one piece that I'm going to add is to see if I can get interns from previous years to host like a live hour with for questions, because I feel like they'll have a different perspective than our current interns who might be virtual for a large chunk of time. So this is one of the Zoom silver linings, that I can get my interns from past years across the country to talk to applicants if they're willing.
I'm getting good ideas from you. We're all trying to figure that out.
I'm currently writing that down, Shona.
That's a great idea. Yeah. Yeah, I figured if I had a 13-year-old, they probably could do a video tour of of VA, but I don't have that capability myself. So we're going to try to work with our medical media department to see if they would do something for us. But yeah, I'm not really sure. I think we might do slideshows or something instead of video. And try to rely also on, you know, that we do have lots and lots of pictures of activities that interns have done during the year that I can show to the applicants, and I think we're going to also rely on just like how we are interpersonally. I mean, it is really hard to do it on Zoom only, but we're just going to do our best. So that's. I don't have anything else to say about that. We haven't totally figured it out.
Great. Switching to the differences between the internship application process versus the postdoc application for those of us applying to postdocs, what does the timeline usually look like for applying, and how is that process different than applying for internship?
In general, I would say it's more similar to applying for a job than applying for internship. So it's a little bit more variable, and it's a little bit, we do rolling applications. So we do our applications, I can't remember the exact date. I feel like we do our applications are due in maybe mid-January, and then we really set up what really is analogous to what a faculty member would go through if they were interviewing. So it's just a little bit, we interview fewer people, so.
Were you gonna say something, Jeanette?
I was going to say that I agree that it is variable in terms of the timeline. So just like internship is very, I know this is a stressful process for you in applying for internship, but when you get to the postdoctoral search, you'll realize how much APIC has made this process more standard. So it's actually easier in many ways to apply for internship than it is to apply for postdoctoral fellowships. I think you have to be aware of what kinds of fellowships you're applying to, because some of the timelines could be as early, for some can be there's some research fellowships that they'll accept applications as early as October, and some as late as April. Neuropsych and neuropsychology fellowships have a slightly earlier deadlines. Some will be early December, for example, whereas even the clinical fellowships within the same program might have it a month later. And then interviews are kind of anywhere between, I think it's November to February. So it can be harder to manage. So you do have to kind of think pretty quickly ahead of what kind of fellowships you're applying to, get some advice from your training director or your advisor about when you should start looking. And then that said, a lot of, for example, clinical fellowships also have not updated their brochures. For example, at Palo Alto, we just typically don't update our brochures until the 1st of October, and then we accept applications at the end of December. So we're kind of about in the middle, where most people, clinical fellowships are accepting applications around.
Our timelines are similar also. One thing that I wanted to add is what you can do now is start to update your CV. Ask your other people that you know, ask your training director questions about where previous interns have gone. Ask if people are willing to share their cover letters, prepare your materials. If there's experiences that you can get on internship that will make you a better candidate for fellowship in a couple months, try and get those. And really think about what you're doing and what you're enjoying and how this lines up with what you want for your future. Because for fellowship, you are going to have choices. And I know that at internship level, it doesn't feel like that. But for fellowship, you might get multiple offers, and you will have to weigh different components that are important to you. If you have personal preferences or requirements, be honest with yourself about your values and what you want.
I think some interns will ask, how many postdoctoral programs should I apply to, or positions should I apply to? And this is, interns cannot believe when I say that typically at our site, our interns are applying between 4 and 8 positions. And think that's just not possible. Like, how can that even happen? And as we were just talking about, the fit for postdoctoral fellowships is even more specific than it is for internship. You can go and get a general internship or a health psych internship many places, but there are only a few places that are going to have specific, let's say, health psychology fellowships. And of those places, not everyone's going to want to be in Seattle, for example, or, Durham, or, so honestly, like, the numbers of actual good candidates that we have that are serious about being in the location and want to be in that particular track are like in the maybe high single digits or low tens, basically. And so you're competing against a handful of other people. So when you do the math, basically, like, that does mean that maybe you apply to 6 to 8 fellowships. And another thing about what you can do now, you can think about who are going to write, who are the people who are going to write your letters of recommendation. And typically, we advise that you have at least one person from your graduate program. Typically, that's your advisor or someone who's very closely knows both your research and your clinical work in the area that you're going to apply to. So let's say in health psychology, and then one person from your internship. Hopefully, it's somebody who is supervising you in health psych rotation. And you think, well, I've only been on internship for 2 months or something. How can they write a letter? Well, we always do. And it looks really strange, actually, not to have someone from your internship write a letter. So they will have worked with you intensively. And so they will be able to say something. And internship work is a lot more similar to postdoc work. And so we would want to see a letter from somebody who's supervising you at that level, as opposed to at a practicum or externship level. And then you have like a third choice, and you can decide internship or graduate program, depending on who's going to give you the strongest recommendation for the particular fellowship that you're applying for.
Great, thank you. Some people have asked for both internship and postdoc, what's the best way to ask about how sites are adjusting to COVID, how they're protecting trainees, those sorts of things.
APIC has asked sites to put in their materials how they have coped with COVID thus far. So we hope that people's brochures will reflect that. So I would say the brochure is the first place to start. And I think that it's okay to really ask the question. I wouldn't shy away from saying, how has this impacted your training program? What changes have you seen for in-person care? What are the safety precautions that you put in place? How are you continuing to assess competencies under these new circumstances? And see what they say.
I would agree entirely. I actually met with our group of incoming residents on a Zoom call before they even joined, to really explain that and give them an opportunity to really ask a question. So at our site, my main philosophy is safety first and then training second. So I think we have to balance that, especially in health psychology, because a lot of our rotations are in the hospital. So we do our hospital-based ones are still in the hospital with PPE and using telehealth as much as possible. And then our continuity clinic, which is outpatient, is all virtual. And then we also have a contingency plan that's in place should, so all of our rotations have a contingency plan, because we just pulled our trainees out last year, which was I think really appropriate at the time, and it worked, but we have a more sophisticated contingency plan now. And I would doubt that I'm the only person thinking that. And so it's just good to know that. And I think when you have a conversation, you get an idea of whether, because different people have different feelings about risk and where they want to be training, whether they want to be 100% virtual or whether they want to be in person. And I don't think you'll know unless you ask.
Yeah, I agree with all of that. It's I think a question we have to all get used to asking. You know, and I think it's a really legitimate question, as it's not something that seems, you know, confrontative or anything. It's just an informational question, and it's good to hear what they've done. And I would say it's good also to ask the current or former trainees to see what actually happened. And not to say that, you know, you're going to be misled, but sometimes the implementation of these processes didn't happen the way that was intended. And it might be just good to know, like, just generally in the institution, how well did everybody actually get the PPE that was promised, and how was that implemented across different units? Is it the same across every medical unit, or is it unit by unit? So getting a sense of that from the people who actually have trained there would also be helpful for you.
I wanted to add one more thing, and that is gathering this information is something that is important for you to evaluate with your own risk tolerance. So if there are sites that say, no, you're going to have to provide services in person, and that just doesn't fit for you, then that might be a site that you want to skip. So think about your own preferences and where the line is for you.
Great. There's some questions about whether you need experience like in a hospital setting or a VA setting or community mental health before applying to those sites. And then kind of a follow-up with that is, if someone's interested in health psychology, can they apply to general track internships as well?
I always think of this as a building block. So you're not going to specialize until you're at your fellowship level in health psychology. And at the same time, we kind of want to see that if you're applying to my site, that you have experiences and interests that are congruent across your graduate training. So it's not that I'm looking for one specific thing, but if you've only been at college counseling centers and your research area is completely not in the area of health, I might in myself question, is this a really good fit for you and your career goals? I do think people can change course. So I don't think you have to have done every health psychology practicum or every health psychology, as psychologists, I think we see evolution and growth in people, and I'm looking for that as well. So, but I think in general, we're looking for, does this make sense? Is there a match?
Yeah, I think Dr. Christensen said exactly what I would say in terms of the kind of experience that we're looking for in the match, and kind of your demonstrated sort of your interest and commitment to a particular area. I think that I would also say sort of maybe a little bit of the converse, I guess, is somebody who, if you've had a lot of health psychology experience, and maybe some of that is more short-term brief interventions or like kind of assessments within clinics, and you have not had certain other kind of basic building block kind of experiences, like for example in longer-term psychotherapy, or we would actually want you to do that too. So I think having a little bit of those general skills are really important, and having some experience in BMed or hospital settings and or interest based on your research is going to be good. It's going to show that you have a fit for us and have the basic skills to kind of learn the health psych interventions that we want to teach you.
think it's sort of finding the sweet spot between things that you have done already that you're going to learn at the site. That's going to be a matter of sort of honing your skills and becoming more developed in a particular area, with some newer experiences and some gaps that you can fill to round out your training. So having a combination of those in terms of the relative opportunities and emphasis of the site is what will make for a good fit.
And to the other question of, can you do a general internship and then go into a fellowship in health psychology? I think you absolutely can. I think the question is, what are you doing in that general internship, and is it building toward an argument that you are interested and are building competence that would help you in clinical psychology? And to the point that the other two presenters have made today, I think the strongest candidates for internship are not those that are only doing technical health psychology, but also have a really good, strong core set of skills in case conceptualization and diagnosis and long-term psychotherapy to be able to understand that process. So at the internship level, we really are looking to train people who are competent toward entry-level practice, not specialized practice, but doing it in a setting that kind of has flavors of health.
Yeah, it's all about finding that sweet spot. When it comes to reviewing applications for postdoc or internship, is there anything that stands out when you're reviewing applications, or is there anything that people should avoid when they're completing those application materials? I know it's a very broad question, so I apologize.
There's so many things that we're looking at, so it is hard to kind of pin down certain things. But I have to say, like, generally, obviously the content of people's writing is important to us, but like, actually, I think you should have people look at your writing. I think it's really important. That's of course the way that you're gonna communicate to us initially, through your application, but also what we expect that you're going to be communicating in a professional manner within our hospital system. So being a really good writer, and if you are working on your writing, actually, being able to understand that and have a good editor, someone to help you to improve your writing is really important. So really make sure that you have people take a look at what you've written. Because the things to avoid, people can make typos and mistakes, but if there are a lot of errors, also like in your CV, please, take a look at that and make sure that you have that good attention to detail. And that's not the most important thing, but in terms of things to avoid, those are things that, you don't want take away from the presentation of your experience and interests. It'll detract from your application.
So I'm at the University of Chicago, and the University of Illinois at Chicago also has an internship program. And every year I get about 5 applications addressed to the wrong training director. And then our programs are quite different. And then I think, well, maybe they didn't apply to the right program. And it stops me from even wanting to read the rest of the application when it could just have been a typo. I will read it, but the person in my view has already lost some points for attention to detail. Remember that your materials are a representation of you. So you want to be seen by us in the most competent, professional, appealing way that you can present yourself.
Well, and to that point too, I think we also want to feel like we're really looking for a match with our program, not just, oh, that's a health program, that seems great. So in cover letters, and when I see, oh, I'm interested in, and literally it's just like our rotations, like in a list, but there's no other evidence to suggest in there that it's not, or if the, sometimes there, I think people will cut and paste those from several different other applications, and then we're like, oh, you like this? Well, we like, for example, neuropsychology, and we don't have a neuropsychology rotation. So I'm like, well, that is, so in a sense, you're kind of making an argument against yourself for a match by those quick edits between different sites.
I think it was getting back to the question about how many applications should you apply for. So you know, each of the applications need to be individualized to the program. So whether it's like making sure you have the right training director or descriptions of the rotations, you're making a case for that particular site. So if it strikes the reader that, oh, this doesn't sound like our program, then I said, well, are they not that interested, or maybe this isn't a fit somehow? Like, we don't want people to raise those questions. You want people when you're reading the cover letter and your CV, that's like, yes, 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 everything is hitting the mark for something who's a fit for us, rather than, oh, is this really for us? or I'm not sure if this person, you know, really read our brochure, is really applying for, you know, understands what they're applying for. So I think spending the time to individualize each cover letter is going to be really important.
I would say, in response to another question that you sent us, Jessica, the cover letter and your CV are the two most important pieces of your application, and really put time into developing those, into having other people review them. Make sure that your CV is in APA style. Be consistent in how you write it. You know, pick an order, either chronological order, verse chronological, stick to it across sections. Make sure that your CV looks polished, because the first thing that we do is sort of quickly scan the CV before wading through the API, which is much more lengthy.
Yeah, and as we wrap up today, any last minute tips or tricks as interns and postdocs are about to embark on this process this year?
The main thing I would say is, even though we're dealing with COVID, I still think everyone applying has an amazing amount of strengths. And I would encourage everyone not to panic. We're going to try not to panic on the training director side. I think I'll speak for at least a couple people. I don't know if the people on the call. So I would really encourage you to take the time, apply to places that you really might actually want to be, focus on making those applications the best you can, and then focus on reaching out to the site to really understand what's going on. I think there's a belief that you can't reach out to the training director even after you have an interview to find out a little bit more about the site. You can. And so, since you're not going to get as much with actually seeing, I would encourage you to take your 12 sites and really invest in trying to understand the most that you can in them.
And also just underscore, you know, you want to be presenting your strengths, you know, really come from us, you know, kind of that point of view, and also with an enthusiasm for new learning. Whatever experiences you've had already, you can be guaranteed that on internship and postdoctoral fellowship you will get other experiences, and that's what we want. We want to do that. We don't want someone who's done everything, because we really want to contribute to your professional development. So come with that enthusiasm for an openness for new learning, and then have your questions for the training directors, for the current or interns or fellows. Make sure that you're also figuring out, is this a place I'd like to go to? Are these people I can connect with and work with? Because you're not going in blind, because you're going to have lots of information, but it's going to feel a little bit distant because of the tech medium that we're going to use. But you want to compare across all your sites and see, like, where are the places that I really feel like I really connected with people that's really going to move me forward in my professional development. So do make sure that you get your questions answered, and make your ratings and rankings yourself as you go along.
I would agree with all of that. With the internship imbalance sort of receding, sites really want to recruit people who want to be there. None of us want to go into phase 2. And so we are motivated also to match with people who are really excited about our training program. So communicate that enthusiasm, think about where you want to go, and think about how we can support you as you proceed towards this bridge from student to professional. So congratulations and good luck.
Thank you, Dr. Shu, Dr. Christensen, Dr. Voss, for your time today and for answering all these questions. This panel was super helpful. And yeah, thank you so much. We really appreciate it. And thank you all for attending today as well.
Thank you. Thanks for inviting us. Good luck, everyone.
Thank you.
Thanks
Yeah.
for having us.
Good recruitment season.
All right, take care, everyone.